Awesome. All right. Well, with that, we will get started with our final office hour of 2023. So exciting. If you haven't been to office hours before, welcome. We're so happy to have you. My name is Abigail Fisher and I use she, her pronouns. I am a designer at the Behavioral Health Administration focused on provider technology. So I've been here for a year as of yesterday. So it's starting to see a bunch of familiar faces on this call, but if you haven't interacted with me yet, please give me an email. I would love to talk with you about your experience as a provider in Colorado. We host these office hours every month. Um, and we use them to talk about, from the Behavioral Health Administration's technology team's perspective, to provide consistent updates on changes and improvements to our managed technologies, to surface and have discussions with you all about technology, to provide feedback and expertise, you all giving us that feedback and expertise on your ongoing technology efforts. And then finally, we want to make it really clear about how you all can further engage with our team through our different research and user testing, and different feedback mechanisms we have for technology. Like I mentioned, we always post recordings and slides from these meetings on the website. So you can actually take a look at the full suite of office hours from 2023 on the website that my colleague Megan will drop into chat. Just for a flavor of the past topics that we typically talk about, we do everything from project updates for initiatives like the Behavioral Health and Claims Eligibility Project, also known as BHC&E, and our project Modernizing C-Card DACODs. We talk about research and user testing findings, opportunities for folks like you to participate in those initiatives. Sometimes we even do live user testing and collect live feedback from you all within the meetings. We provide training and provider onboarding updates from a technology perspective. And then we do occasionally bring in other BHA divisions. For instance, we had our BHA programs team speak with this group a couple of months ago to describe what BHA programs are and how you as a provider can learn more. A couple of housekeeping items before we dive in. We have a hot topic survey that we use to sort of orient our Q&A session that we always have at the end of the call. So please fill that out if you ever think, hey, you know, there's a topic that I'd really like the BHA tech team to talk about. That's a great place to put that, and then we'll bring the right people to the group in order to address that point. Like I said, our BHA provider website is the office hour source of truth for our agenda, slides and recordings, our Zoom meeting registration, and again, that hot topic survey. As a reminder, you can always email our provider support email with the subject line office hours or any subject line if you have any questions related to technology. And finally, please sign up to stay informed. Megan's going to drop in that email list that's already there. If you've already filled that out, you don't need to do that again. But we will be facilitating sort of a more formal newsletter type communications around this event series. And that means we will be sunsetting the Google group. The last email you will get from me on the Google group will be a recap of this agenda and meeting. And after that, everything will come through that new email service. So please make sure that if you haven't signed up for that email list, please do, because that's how you'll be kept informed of 2024 office hours. I'd also like to encourage you that if you have a topic that you'd like to talk about today, you can put it in chat at any time, and then we'll make sure to read it out loud and begin with those thoughts when we get to the Q&A portion of the day. And if you have any questions so far, please let me know in chat and I'll make sure to answer that for you. But in terms of our topics for today, last time we heard from you all that you would be interested in having us talk a little bit about, you know, and give a little bit of a 2023 recap of the type of tech initiatives that we were able to accomplish over the past year. So we'll spend a couple of minutes talking about that. I'll turn it over to my colleagues, Jackie and Troy, to talk us through the technology training schedule that we're able to share so far for 2024. I'll hand it over to my colleague, Rebecca, who will talk to us about some exciting initiatives with our ladders system, which is, if you don't know, our BHA licensing system. And then I'll hand it over, or I'll say these myself, but some updates on the Modernizing C-Card DACODS project. And finally, we'll wrap up with a few updates on the Behavioral Health Claims and Eligibility project. So hopefully those slides will take us around 25 minutes, and then we'll have 25 to 30 minutes for a Q&A and open discussion at the end of the day. Any questions about office hours or the structure of office hours before I dive in? All right. Well, I'm not seeing anything, so I will keep plugging along. So yeah, we're really excited, and like this was such a lovely way to sort of wrap up or begin our last office hours of the year. But we wanted to share just a couple of wins from 2023. And what we did is we sent out a little survey to our technology team at BHA, and these are some of the wins that our colleagues shared with us. And it was really, really exciting and lovely to see those responses come in. So I'll read these and provide some more detail here. But we launched the central registry for our opioid treatment programs, improving the process of admitting and discharging patients from opioid treatment programs. I'm sure some of the folks on this call will remember a time when you had to email someone to admit and discharge a client from an OTP, which is, obviously not a very succinct or efficient way to go about that, and lots of room for error there. So we're really excited about this tool and hope you've seen the impact that it has had if you are an OTP provider. And also, we would love to hear additional feedback from you on this about how this has improved your working lives, and or if you have feedback on how to improve Central Registry even further. We've been improving our data ingestion, analysis, and presentation for providers through our technology partner, Snowflake. So big round of applause. We call our data team at the BHA B Health. So big round of applause to our B Health team that has been working really tirelessly to ensure that providers are able to access their own data, and that data is in a presentation that makes sense and is usable to all of you. We're really excited to continue that work into 2024. Like I mentioned, my colleague Rebecca has some really exciting updates on our licensing system ladders that marries our new rules to our technology system to make sure that everything is moving smoothly there, and that payments and licensing structures are making sense to our providers. And then finally, across a variety of initiatives, we conducted research, user testing, and technology pilots with hundreds of providers like you on topics like bed tracking, inpatient and residential referrals, peer navigation, and data reporting and administrative burden. Ooh, that's a mouthful. So, I think that this quote from one of our colleagues really sums it up, and I hope this is your takeaway as well. Anytime our team gets to speak with people outside of the BHA providers, I feel proud. It's an honor to do work in service of improving how people give and receive care. And I think I think that's not going too far to say that that is a sentiment really held by everyone on our technology team. And we really just appreciate all of the providers like you that help us to do our work better. So thank you for helping us ring in 2024 with all of you. And we just like to take a minute. Like I said, I put this in chat. We'd love to hear from you. Like, what are your teams focused on this year? How could we support you with data and technology needs in 2024? I'd love for folks to take a couple of minutes and come off mute if you feel comfortable. Put items in chat if that feels better. Or you can always, email us. But we would just love to know and understand what your priorities are for 2024, and how, we might best work together in the coming year. Ooh, learning management system. Tamara says that she's looking forward to the learning management system. Elizabeth has mentioned that the biggest priority for her is the BHC&E project. So great. Yeah, we're really excited about those projects as well. Well, we can keep going, but like folks, feel free to put those, what you're excited for, what you would like the BHA to connect with you on in 2024. And also know that in early 2024, our team is going to work to create a more detailed timeline and roadmap so that you all are able to kind of track our progress along with us. So that will be forthcoming. And with that, I'm going to hand it over to my colleague, Rebecca, to take us through a couple of those updates that I mentioned on the BHA licensing system.
Thanks, Abigail. Afternoon, everyone. Rebecca Mays here. Many of you know my name just from working in the ladder system, and I provide a lot of the technical support when things don't go the way we want them to in ladders. So we've had a lot of updates over the last month. As many of you know, we upgraded the system to start accommodating those BHE applications as well as the 2765 designations and the essential safety net and comprehensive safety net provider applications. There is a lot of communication that has been going out from the licensing team as providers.
And Rebecca, I'm just getting a note that you're maybe a little hard to hear. So maybe if you could come closer to the mic, that would be great.
Yeah, I'm also having a lot of internet stability issues today, so I apologize. So I'll try to make it a little bit quicker. But yes, those of you that work in ladders, you should be receiving notifications that you need to go in and start your BHE application as those renewal dates come up. Please check out these websites that are linked here. We can drop those in the chat as well. And if you have any questions, please reach out to that ladder support email, which we can drop in the chat as well.
Yeah, thanks, Rebecca. And I'll just repeat that last part. So if you need any support, Rebecca's going to put that ladder support email in chat. And that would be a great place to start, in addition to the information shown on this screen. Thank you so much for that update, Rebecca. Next, I'm going to hand it over to Troy and Jackie to take us through our training schedule.
Well, hello, folks. Yep, I'm in my car. This training schedule is going to be different. We kind of set up the format going to be in Zoom. It looks like we're going to have a lot more ability to track who's attending, attendance. You'll be able to get a respondent or an email for when your training is going to be set up. Right now, what I'm looking at is DUI training twice a month is what I'm looking to populate here soon. I have a really big demand for the DUI training. I'm going to be incorporating the level 2-4 plus in the trainings to talk a lot about the competencies and the phases in level 2-4 plus, as it is different than the traditional tracks A through D. Because there's always confusion when somebody starts treatment pre-trial, not knowing what level of treatment you're going to be sentenced to, but they start treatment and then they start find out that when they're sentenced to a 4 plus treatment, they're not going to get credit for it. So they spent 12 weeks in treatment. So we need to get this across the board. Also, what Rebecca had mentioned, if you could send me links and training information I post on TMS for the questions that have been coming to me, I can just refer them to that as well. The next one is the day codes training again. I'm going to offer that once a month. I'm going to start working on some CCAR training as well. But it's been very hard because I'm just really overwhelmed and bombarded with so many things. And thanks, Mike, for helping out, and Amanda as well. My plate's pretty full, but as soon as I get more training, feel free, if we have providers on here, to email me at any time. I do apologize about the reply time. We have just been inundated with requests for the data systems as we have implemented over a couple of years ago security features that lock you out. if you do not sign the statement of compliance form or there's no activity in a 90-day period. So just be aware of that, that if you keep wondering, especially probation officers wonder why they keep getting locked out, we have a security feature on our data systems that will automatically lock you out. So again, feel free to email me. Any questions?
Not seeing any questions. Thanks, Jackie.
You're welcome.
And if folks do have questions, like, please put them in chat. We will put Jackie's email in chat per Elizabeth's request. And definitely we'll be following up with these slides and links as well. All right. Next up, we have, and it looks like Megan is still here, an update on the Modernizing C-Card Day Cots project. So, Megan, are you still here? Okay. Everyone, I'm just going to introduce you to Megan because I don't know if you've seen Megan on these calls before. Megan is our new, one of our new designers. So for folks, this is maybe a little too much information, but we have 3 divisions within the BHA technology team: provider, public, and B-Health, which is our data team. So Megan is our designer assigned to all things data, and will be, inheriting this project that I have been working on. So we'll be working on it together. So I'll hand it over to Megan so she can introduce herself.
Awesome. Thank you, Abigail. As Abigail mentioned, my name is Megan Lenz, and I joined BHA as a designer on the BHealth team back in September of this year. So I've been supporting Abigail in next steps for the administrative burden report that she produced and hosted shareouts for back in October. Since then, we did collect feedback from this provider community, and I first just want to say thank you all so much for taking the time to engage with us and provide that really thoughtful feedback to that entire report and those shareouts. We had initially planned to respond to that feedback in mid-November, but have run into some delays. So these form responses will still be published with corresponding BHA responses to the project site by early January. We will be sharing emails and communications when that is published so that you all have access to that robust documentation. Following the publication of the community feedback, we will be hosting 3 more share out and discussion sessions, which are to be scheduled, but we're aiming for the first 2 weeks of January for those feedback sessions. So please just sign up to stay informed on the provider email list, as well as on the C-Card Day Codes microsite. That's where we will be posting all of those updates, but I look forward to engaging with you all soon on that project.
Thanks, Megan. And yeah, I just want to say that delay is in part because of like the wonderful feedback we got. I think over, Megan, you can tell me if I'm wrong, like over 50 responses. So we're just taking the time to ensure that we are in detail reading each of those responses and providing an appropriate response. So thanks for the understanding around that delay as we just give that, great amount of feedback the respect that it deserves. Elizabeth, I see your comment in chat about the error links. Let me follow up with you on that to make sure that you're getting those correct links. Thanks for pointing that out. All right. All right. And just in time, I believe we have Dan here who I can turn it over for some updates on BHC&E.
Yes, I did join and finally got my screen set up correctly. I don't have a presentation for this meeting, but I can cover a number of topics where we and HCPUF have received some questions on the implementation of BHC&E in the HCPUF systems and some of our plans going forward. First of all, we've received some questions with BHA services as displayed in the Medicaid Enterprise Systems environment. If you're not familiar with that term, that's all of the computer systems that HCPUF runs supporting Medicaid. County eligibility workers see the term BHA Community Services as the high-level program group through their interfaces into CBMS, as do Peak Pro users and Peak users. In the interchange provider portal, the services are listed as the BHA benefit plan with the acronym BHAB. Both of these terms, BHA Community Services and BHAB, refer to the same set of programs that are defined in BHA contracted providers contracts. Because the BHA Community Services and BHAB appear as a high-level program group alongside other programs like Medicaid, CHIP Plus, and the other programs that are managed for eligibility through CBMS, there have been a small number of Medicaid providers incorrectly billing Medicaid for services provided to people without Medicaid eligibility. As a clarification, the Medicaid behavioral health benefits are listed as BHOB in the interchange provider portal, which is different than BHAB's, and the services provided by both are different. Providers must be under a BHA contract to offer any services funded through the BHA. And reporting of encounters continues to be through CMHC's ASOs or MSOs in order to meet the current contractual obligation of those BHA contracted providers. BHA and HCPF are preparing additional communications for providers and county eligibility workers to clarify the relationship of the programs, who can offer what services for the various programs. When these communications are approved and released, we'll make sure that we distribute them as widely as possible to all providers through this group here, as well as HCPF distributing them through their normal Medicaid communications processes. We're also making some additional changes in the system to aid in clarification of BHA programs and the role of different providers within the different high-level program groups. And fundamentally, though, program offerings remain unchanged. Only BHA contracted providers can offer services covered under BHA programs as defined in their current contracts. Providers determine which, if any, of the programs that's available to each client that they see. These providers are the CMHCs and the provider networks created by the ASOs and MSOs. And anybody who is a Medicaid provider, they could also be a BHA provider, but on the Medicaid side, you continue to offer the services based on your relationship with HCPF, Array, or managed care organization. We have received, both us and HCPF received a small number of questions from providers about individuals possibly losing Medicaid benefits and gaining BHA eligibility. There was no change to any HCPF managed benefit program with the addition of BHA programs into CMS, CBMS, or the interchange. If someone lost Medicaid or another program eligibility, it should be for some reason related to changes in their household status, not because of the BHC&E project. People have the ability to appeal an eligibility determination through procedures in place with HCPF. If you have such cases where a person lost eligibility, we can do additional research with HCPF as to why a person lost their eligibility if we get specific information like a member ID number, the program involved, and the dates that events occurred. We do urge people to appeal an eligibility decision if they think it's warranted for their particular case. In talking to HCPF earlier today, we did find out that there is a revalidation process going on right now. So it's possible some people could lose a previously held benefit, and with BHA in the system now, could show up with BHA eligibility. But again, that has to do with changes to their household environment, not just because BHA was added to the system. Before I move on, are there any questions so far on this? Thanks. Give me a chance to take a drink here.
Yeah, I'm
Is there a
not seeing
question?
anything. I'm not seeing anything in the chat, just in case you can't see that.
Okay, thanks. As far as the rollout of BHC&E for BHA contracts to providers, We are continuing to work on supporting documentation. There was a recent question on that. There are a number of things we have to have in place, and we're working to complete those to maximize the time that providers have to implement any changes. As we've said before, though, use of Peak Pro and reporting encounters to the interchange in the X12 organization CR3 standard 837P format will be required in the future for all BHA contracted providers through their respective administrative organizations. And HCPF continues to make additional system changes to support the rollout. You know, once we go start implementing certain things and running certain things through, we do know that additional changes have to be made, and HCPF is diligently working on those. We don't have a schedule yet on when we would onboard individual providers. Right now, we're on hold for adding any more early adopters to the test encounter submissions. When that opens up again, we'll let you know in case you'd like to test your system readiness for encounter submissions to the interchange. Right now, unfortunately, it's a resource issue before we can bring other people on. We have had a limited number of successful encounter submissions going into the production interchange to validate the system changes we've made. And it allows continued development of things in the BIDM, which is invisible to you guys, but it's related to reporting that HCPF and the BHA sees on encounters that are submitted on the BHA program. So we're very happy with the provider efforts there, and we'll continue submitting additional encounters into the production, into the test system, and into the production system as we need to test different things going forward. I'd really like to thank everybody who participated in Peak Pro training. The final training sessions for the first two groups are finishing up now. There are multiple people from BHA providers who have active production Peak Pro accounts, and they're evaluating how to best fit Peak Pro into their organization's operations. If any questions come up from use of it, please feel free to throw those questions our way, and we'll get your responses. If it's a system question on Peak Pro access or technical related to access, then the question should go to Peak Pro, but please copy us on those too so that we kind of keep track of how good our training is. I just got an update on January training. So we'll start another set of training sessions on January 9th. Again, there will be 2 time periods offered for each of the first 2 sessions, and you only have to attend, one of those time slots for each session. So January 9th and 11th are the first session, and January 15th and 16th are for the second session of training for this next group. We will implement a cutoff after which we won't accept any additional people signing up for training. That will be January 4th. And we're doing that just because of trying to maintain the right invites for the meetings and whatnot. We've had a lot of challenges making sure we didn't accidentally drop somebody. So we're going to put that cutout of January 4th for people to sign up. We will put this information out in writing, in a group email, and in people who had signed up or expressed interest before. HCPF has that list, so they'll be sending out the dates to that group of people if they want to join this round of training in January. And to make training easier and more accessible, we still are on track to transition to a completely online, self-driven training program during the second quarter of 2024. And hopefully that'll make things a lot easier for getting people into training. We've been asked to provide a notional workflow of how you might use Peak Pro within your organization. We do have a document in review, and we'll make it available after a little additional vetting. It will come with some caveats that your mileage may vary. Every organization is slightly different in how they handle onboarding new clients, for example, internal resources. I know one organization that uses external resources. So exactly how you use Peak Pro or how you might need to use Peak Pro will vary with the organization. But again, we'll make this notional workflow available as soon as we get it through the final review process. And that concludes my update notes here, unless you have some additional questions for me. And again, questions anytime through email or phone call is always welcome.
Yeah, Dan, I have a question from Elizabeth in the chat, 2 questions. The first one being, to clarify, there's nothing the ASOs other than Signal can do at this time to prepare for BHC&E.
That is correct, Elizabeth. I know you're waiting for some of those supporting documents, and there are just a couple of things we have to have in place. The companion guide is probably a big one you're looking for. What's in there is not going to be massively shocking to you. It's the same information that's submitted in encounters today that go into BHA. Some of the information might just be in slightly different fields, which I understand will have a system impact, but we're working hot and heavy on that, and we'll get it out as soon as possible. There's some other things in terms of clarifying some eligibility things, updates to finance and data protocol that are in the works that are related to BHC&E. So we're working on a number of things there that we'll get out as soon as we can.
Thanks,
And
Dan.
so, yes.
And then there was
Sorry, answer your question, Elizabeth. Yes, there's nothing you need to do right now.
Okay, thank you.
Other than Peak Pro training. Sorry, Abigail. I keep
Yeah, no, it's okay.
follow-on
That was
comment.
actually the next point, was if you could just provide Dan some additional information on Peak Pro training in the chat, just for time's sake, so we can keep us moving, if that's okay.
Absolutely, I'll do that when there are no more questions for me.
Okay, yeah, and unless there are folks that want to come off mute, which you can definitely do, those were the last questions I had from the chat. All
Right
right.
now, I think, yeah, sorry, Elizabeth's got a new question in here. I think it's beneficial for ASOs to take the Peak Pro training so you understand what's going on in your provider environment. If you offer any type of other, onboarding or screening services, Peak Pro would be a useful tool to have. It's been a while since I've read an ASO contract to see exactly what's required of you, but it is primarily targeting the providers.
Yeah, thanks, Dan. And as always, all of this information, we will follow up via that follow-up email, and it will also be on the website via slides as well. So not to worry about collecting links. All right. Oop. So that was the last topic that we had to go over, which gives us just a couple of minutes to go over, well, about 30 minutes, actually a little under 30 minutes for open discussion and Q&A. And so we have a couple of questions. Like I mentioned, we have 3 domains in the BHA, so I'm going to hand it over to my colleague, Alex Orlov, to talk a little bit about questions that she has for providers like you.
Awesome. Thank you so much, Abigail. And hello, everyone. My name is Alex Orlov. My pronouns are she, her, and I am a designer on our technology team, and I am focused on our public-facing tools. So I primarily work on the OwnPath online care directory. That's ownpath.co if you haven't looked at it recently. And our team is currently working on creating a way for providers like you to more easily update their information on the OwnPath care directory. So I wanted to come to the provider office hours today to ask you a few questions about how your organization creates awareness so that people in your community know about you and your services. So if we could take the next few minutes, I would love if folks could chime in via chat or come off mute to answer these 2 questions on the slide deck. The first question is, What does your organization do to ensure people in the community know about you and your services? And the second question is, who at your organization is responsible for creating awareness within your communities? Who is responsible for keeping a website up to date, posting on social media, or other methods you have for letting folks know about you and your organization? And I know I'm a new face here, but please don't be shy. There are no wrong answers. I'm just hoping to hear from you all about how you think about directories, websites, and creating awareness.
So for Vantage treatment centers, we have a outpatient pretty much a schedule that we update. Has a per site, what groups we offer. Anything we have is telehealth. For our residential beds, we actually have an active wait list that shows when our next available bed is. If there is a wait list, what the projected bed date is, and that is actually updated per change. And I guess to create awareness, there's any like community events, we work a lot with probation parole. So we're contacting them. We'll send some newsletters through emails. We do have a social media account that we update. What changes we have. If clients are put in their consent, we'll put in they graduated our program, just showing the positive impact of our company.
Thank you so much for sharing, Roman. That all sounds fantastic. I didn't catch the name of your organization. Do you mind repeating that or posting it in the chat?
It's Advantage Treatment Centers, ATC.
Advantage Treatment Centers, awesome.
Yes.
Taking a note there. Thank you.
And Alex, Roman and I talk a lot, so I can provide that email introduction for you. Thanks, Roman.
Hi, Alex. This is Tamara from North Range Behavioral Health. I would say for your item number 1, I'm stumbling over the insure people. I don't know how they take it. I just know how we deliver it. So I might be speaking more to we deliver it in the ways you have identified there, directories, websites, social media, and such. I think I'd also like to add our patient portal. It might not be the same as seeing everything on the website, but I think a patient, him or herself, can see their own information. And so I might add that. I'm hoping that OwnPath can be an integral part of that. So we'll look to see what that is. I think also it's the community partnerships that we hold. When we do things with United Way, we've got the United Way logo, and United Way puts the North Range logo. When we do things in partnership, I hope that reaches other audiences that might not have seen us initially. We also have that Google feedback form. So we're looking at that, and it's not totally anonymous, but it's also not very forward. So you can remain anonymous. And so we get information that way too. So that might be part of that. And then who's responsible? I really like this question for North Range because I don't think it's any one person. I think it's anytime someone is seeing another person. Maybe I've got a North Range sweater on and someone stops me at the mall. Maybe I've got my North Range grocery bags and they stop me at the grocery store. And I hope that I'm presenting myself in a way that makes it feel like North Range might be a place I can go to, or I can encourage my family to go to, because this other person was kind of fun and smiled at me, something. So I hope there's a level of that that's informal. And then formally, definitely our executive team and our marketing team takes a great responsibility in making sure that we're creating that awareness. We hold, for May is Mental Health Month, we have the proclamations, and Suicide Awareness Month, and Addictions Month. So we engage, I hope, our community sees it that way, with our community in that way, so that we can help them and be there for them.
Thank you so much for sharing that. That is really wonderful. I loved what you had to say about, being a representative of your organization and hoping that a positive experience might inspire someone. I noticed we had a few comments in the chat. Elizabeth said North Range does a fantastic job with sharing the info. I love seeing all the social media posts. And Shauna says Access Health uses our website, social media, Facebook, Instagram, LinkedIn, radio, flyers, in-person community events, plus others. Thanks, Shauna. If one other person wants to come off mute and share with us, I would love that.
Alex, this is Elizabeth with Carolyn Behavioral Health. One of the things that I've seen one of our providers do recently in our Park County area is they're holding symposiums and mental health alliances and farmers markets where they're getting out and sharing information about crisis services, about the amazing work that's being done at the BHA level, also at the provider level. I think I've seen a lot of ingenuity and kind of new ways of disseminating info, which is really powerful to see. Relating back to what Tamara with North Range already shared, it is really about, I think, brand recognition and people identifying, oh, that's the North Range logo, or oh, that's the Colorado Crisis Services logo. And then relating that to a positive interaction they've had and how much that means to them, so that then they turn around and seek services. I think that's probably the most impactful thing I've seen happen recently, and just really doing a lot of community education with partners.
Wow, thank you. Yeah, that reputation within the community is so important.
Yes, absolutely.
I see one other comment in chat. Danny says, I apologize, I don't have an audible voice, but I would say that the importance of community partnerships and engagement in our community events is our most effective tool. Awesome. Thank you, Danny. And thank you everyone for sharing today. I really appreciate all of these responses, and also want to thank you for your service. As someone who lives in Colorado, I really appreciate everything that you are doing. If you are interested in providing additional feedback, I do want to do a quick nudge. You can email me. My email is alexandra.orlov@state.co.us. If you email me with the subject line office hours, our team will reach out to you for more feedback as we think more on improving OwnPath and improving how providers can update the information displayed there. Thanks, Abigail. Back to you.
Yeah, thanks, Alex. So I'll stop sharing screens because this is the part of the day where we just do open Q&A. But before I stop sharing my screen, just wanted to share out our 2024 office hour dates. Again, just like last year, you'll be able to kind of do one Zoom registration and be able to attend all of those. So we will follow up with that new registration link for 2024. I'm going to stop sharing the screen, but another question we could have in addition to any questions you have for us today is anything you'd like to see us do differently in office hours in 2024. But with that, I'm going to hand it over to you all, because this is the rest of the time is for you to direct us. What questions do you have for us, and how can we help you with any BHA technology questions today? Yeah. Any questions on the topics that we reviewed today? And just as a refresher, we've talked about behavioral health claims and eligibility, C-card day codes modernization. We've talked about ladders, BHA licensing updates. And then finally, you know, what can we do to make office hours better in 2024? All right. Elizabeth in chat said that she's found meetings in and of itself to be helpful. Just keep plugging along. Thanks for that, Elizabeth. Janelle, I see your hand.
Yeah, so this is hello everyone. I'm Janelle Schaefer. I'm the interim division director of health information technology at the BHA. So this forum is not for me, but I had a prompt based on the conversation and the pieces that Abigail had alluded to and Alex's earlier that I'm curious for feedback on, which is when we were talking about branding, marketing, right? Like the community level building of that. So it's less about like an ad campaign. It's more about like how you reach people at the right place in community, promoting, like having that recognition. I was super curious if, as your organizations do any of that work, like as providers, if there's any coordination right now or connection to like statewide campaigns or fundings for those types of brand efforts or like promotional efforts. So it's kind of a little bit back, but I was super curious how state dollars on that, if they at all ever are like working with your comms offices or your marketing or your branding offices to create that public awareness.
Elizabeth, go for it. I see your hand.
Hi, I can only speak for Colorado Crisis Services, but I did just want to share that contractually, the ASOs and the ASO crisis providers, we are required to use the Colorado Crisis Services logo on all documents, marketing materials, websites. So that's something that we do for that contractual reason, but also because it helps, like you said, with branding and promoting community awareness of services. In the event that one of the crisis providers or even the ASOs speak publicly, like a news interview or providing information in that type of like a format, we do connect with the BHA's media office for, you know, like tips and training and key points to kind of keep us on track and make sure that we're consistent with the messaging and with what the BHA expects of us.
Thanks, Elizabeth. Anyone else have a response there?
Janelle, I believe we also at North Range have some Weld County dollars that have gone towards communication, marketing, that type of thing as well, just to help that element out.
And just for folks that can't see in the chat, Janelle said, thank you. This is super helpful to know. Tamara, did I see you come off mute? Sorry to interrupt.
Yep, that was me talking about Weld County.
Awesome. Thank you. Okay, well, what we do if the group gets a little quiet, which is totally okay. I know that some people prefer to give feedback one-on-one, which is completely great. But what we do is we stay on the chat and we'll stay on the call in case anybody comes up with a question that we can answer until the 2 o'clock hour. And then if not, if everybody leaves, we'll log off early, but we'll be here until 2. But if you want to take a couple of extra minutes back to go take a break and get off your screen, I am sure we could all use that. So thank you so much for your participation today, and we'll stay on in case there are any questions, but look forward to seeing y'all in the new year. And thank you for such a great 2023.
Hey, Abigail, I need, if you could provide the updated registration link for, let me scroll back up. The
Yeah.
day code training link that was entered.
Yeah, I don't personally have that. So Jackie or Troy, if you could drop the correct link both in the chat and on the slides, that would be great. And if you can't do it right now, Elizabeth, I will follow up with you one-on-one. And I will also, when I send out the materials, they will all be updated.
Okay, thanks.
Sorry about that.
It's okay. I'm just glad I checked because I usually send out these meeting notes to my providers right after the meeting is over.
Can you give her my email? And I'm on the computer right now. I can look at it.
So, yep, Jackie, how about you, Troy, and I can loop up after this, and then we'll get those links out.
That sounds.
Okay.
Thanks, Elizabeth. Sorry about that.
That's okay. Thank you. I'm gonna go ahead and drop off. Thank you so much, and I'll see you guys next month. Have a great holiday.
You as well.
I'm getting on Zoom right now. Yeah, I'm on my phone.
Hey, Jackie, why don't we talk one-on-one after, just to keep the recording clean? Thank you.
Oh, I didn't know you're still recording. Okay, no problem.
All right. Well, it doesn't look like there's any other questions, so I might go ahead and end the meeting just a couple of minutes early. So last call, any questions? All righty. Thank you everybody so much. This is the end of December's 2023 office hours for BHA Technology, and we will see you all in the new year. Look out for the follow-ups from this call towards the end of the week. Thank you so much. Bye.